Welcome to Amarillo Diagnostic Clinic Sleep Disorders Center. You've been scheduled for a polysomnogram, also known as a sleep study. Your study preparation will normally begin in the evening between 8 p.m. and 9:30 p.m. Our sleep technicians will greet you and direct you to your private sleeping quarters and bath area. Feel free to bring your toiletries and usual sleepwear. It is helpful to avoid using hair products or skin lotions on the night of the study. You may also bring your own pillow. Stuffed animals are acceptable, but please leave your live pets and spouse at home. Like all of medicine, your sleep experience will begin with paperwork. Not only does it make you sleepy, but it helps us know how you spent your day. Consent forms for the testing and video recordings, if needed, will be given as well. To determine if a sleep disorder exists, your physician will need to know what physiologic changes occur during your typical night of sleep. Our first goal will be to determine when you fall asleep and what stages of sleep you reach during the night. We do this by recording your brainwave pattern, known as the EEG, as well as your eye movements and degree of muscle tone. This is done by a series of electrodes applied to the scalp, forehead, face, and chin. The skin is first cleaned and scrubbed. Then the electrodes are attached with the gooey paste and taped into place. This usually takes about 30 minutes and is a good time to ask the technician any questions you may have thought of since your office visit. Next, a typical EKG monitor is applied to measure your heart rate and check for irregular heartbeats during the night. A finger oximeter is applied as well to measure oxygen saturation during the night to determine if your body is receiving the needed amount of oxygen while you are asleep. One of the most common reasons a sleep specialist is consulted is because of snoring. A small microphone will be applied to the neck, and length of time snoring as well as loudness will be recorded. Often, people will have leg movements or jerking at night. This may lead to sleep disruption of which we are unaware. This can cause tiredness and sleepiness the following day. Electrodes are applied on the shin of both legs to measure leg movement during the night. One of the major sleep disorders that affect millions of people is sleep apnea. To monitor respiratory effort during the night, flexible belts are placed around the chest and abdomen. When you inhale, the belts expand, and during exhalation, return to their original position. This allows the technician to record chest and abdominal movement during the night and to look for any abnormalities that may affect airflow in and out of the lungs. To measure the airflow specifically, an electrode known as a thermistor is applied between the nose and mouth. This extremely sensitive instrument detects minute changes in temperature which can be directly correlated to airflow in and out of the lungs. After all monitors are applied and you are comfortably in bed, the technician will ask you to perform a series of maneuvers to calibrate the equipment. An intercom in the room will allow communication during the procedure and also throughout the night should you have any needs or require bathroom facilities. Once the calibration is complete, it's time for a good night's sleep. Our technician will be available all night for your needs, but will endeavor not to disturb you unless absolutely necessary. If during the early portion of the study the technician was to note abnormal breathing patterns or low oxygen, the technician may awaken you to apply an oxygen cannula or a mask called a CPAP mask. Instructions on its use will be given prior to turning off the lights and beginning the study. Your study will usually be complete about 6 a.m. the following morning. Again, you will be asked to fill out a questionnaire about your perception of your sleep pattern and the overall sleep clinic experience. We understand that you have a choice in healthcare, and we would like to thank you for choosing Amarillo Diagnostic Clinic Sleep Disorders Center.